Hello and welcome. My name is Dr Askari, the Medical Director and owner of Askinology, and I'm here to answer your questions. Now, over the last week or two, you guys have been posting questions and commenting on my last video, and I have picked the most common one, and this week it's all been about ages. When is too soon or too late to start thinking about injectable treatments? So over the next, minute or two, I'm going to answer some of these common questions. So let me answer this one. The first thing I'd like to say is that no one needs to have any of these things. No one's going to die because they don't have their Botox. So no one should do anything either. It's really just if you would like to. So when should people start thinking about Botox if it's something they're interested in? I would say round about the mid to late 20s, because that's when we start to notice the beginnings of the signs of aging. Short answer, yes, it is true. Well, how does this work? Well, Botox stops the muscles of your face working so hard, and it stops them folding the skin and creasing it in the same place every single time. So if we can stop this for a few months, we can stop the progression of these lines and even stop those lines looking so bad in the first place. Absolutely not. You can dip in and out of Botox treatment whenever you wish. There are no kind of knock-on consequences. You're not going to look worse if you don't continue it. It's a bit like a haircut. Have your hair cut, your hair's going to look great. You can go back to the hairdressers whenever you wish. There is no obligation to do so, and your hair's not going to look worse because you had the haircut. Okay, quick answer. They can do, depending on how deep and bad the lines are. So if you're reasonably young and you have a few lines that are quite shallow, well, Botox is likely to actually get rid of those. If you're older or if you have deeper lines that have been inset for some time, yes, Botox can improve those, but it's unlikely to get rid of them completely. Quick answer, absolutely not. It is never too late to try and look your best. The real question is it going to be appropriate for you? But that's a relevant question regardless of your age. Well, the short answer is it really depends on the individual, but generally, round about your late 20s, early 30s is when you're going to start seeing some subtle changes in the volumization of the face and flattening of curves. So thinking about it around this time would be ideal. Well, as I always say, these things are done on a case-by-case basis, but I'd flag up a really important point, which is that we don't see people or treat people under the age of 18 at Askinology, and I'd be really disappointed to hear other practitioners around the place treating those under the age of 18. So early 20s certainly isn't too young, but it would need to be appropriate and considerate. No, it's never too late to do something to look your best. The only thing to bear in mind is that if you haven't had any of these types of treatments until your late 50s, you will have lost a significant amount of volume from your face. And so the amount of treatment, the amount of filler that you're going to need to get yourself into a really good place is going to be more than if you were 30 years old. So guys, thanks for all your questions over the last week or two. Please keep them coming in. I want to try and answer as many of your questions as possible. Ask about different subjects, not just injectable treatments, but peels and skin conditions, anything to do with making skin look fresher and brighter, and I'll look forward to answering them the next time.